is Jessica. I'm going to be your nurse today. Can you identify your name and date of birth?
Nora McGee, June 2nd, 1995.
Okay. I'm just going to take a look at your wristband to confirm. Okay, good. So what brings you in today?
I've been feeling shortness of breath, like kind of difficulty breathing past few days.
Okay, have you ever been diagnosed with asthma, COPD, emphysema, or anything recently?
Yeah, I have asthma.
Okay, so when were you diagnosed with asthma?
I think when I was like 6.
Okay, so it's been a little while now.
Mm-hmm.
Are you on any medications for asthma as of now?
No.
Okay, so have you been doing anything different that seems to make your symptoms worse, such as walking, exercising, carrying a lot of groceries, things like that?
Yeah, I mean, it does get worse when I'm doing a lot of exercise, or if I'm walking too long or carrying stuff. I've also been kind of anxious lately with school. I've been really stressed out, so that makes it worse too.
Okay, so when you walk for too long or exercise for too long, make sure you're not pushing yourself and you stop. Because if you push yourself, then you could have an acute asthma attack or you could lose oxygen and faint. So it's always important to remember when you get these symptoms to stop whatever you're doing, to take a break and sit down. Okay, so I know you said that you were diagnosed with asthma when you were younger. Were you ever prescribed any medications like an inhaler, or were you ever hospitalized because of an acute asthma attack?
I don't think that I was ever hospitalized, but like I said, I was diagnosed when I was really young, so I don't remember too much about like what I was prescribed, if anything. My mom might be able to answer a little better.
Okay. Hi, nice to meet you. I'm Jessica, the nurse, taking care of Nora today. So can you just tell me a little bit more about how Nora was diagnosed with asthma when she was a child?
It was mostly sports-induced asthma. She had difficulty breathing when she was on the soccer field. We brought her to the doctor, and she just said that it was acute episodes, but nothing that she needed to be on medication for. But just as she's gotten older, she showed more symptoms, and lately it's just been reoccurring issues, so that's what we came in today.
Okay, that's no problem. Thank you for telling me. I'm just going to go get my computer so I can look up what the doctor has prescribed you for your symptoms, okay? Okay, so it looks like here that the doctor has prescribed you a Spiriva treatment. So I'm going to go over what Spiriva is and how to use it with the respiratory therapist. So just give me a few minutes, I'm going to go get her and we'll come in and teach you guys all about it, okay?
Hi, my name is Elizabeth and I'm the respiratory therapist and I'm going to teach you how to use Spiriva. So what you have to do is you have to open the top, you have to place the pill inside, but you have to make sure to crush it, otherwise you won't get the effects that your lungs need. Once you crush it, you have to inhale it for 10 seconds or as long as you can. That way your lungs get all of the medication. And once you're done, you don't throw away the inhaler. You just have to empty out any sort of residue that's left inside, so that way it's nice and clean for your next use.
Okay, how often do I take it?
You take it once a day.
Okay, so I'm going to teach you some of the pharmacodynamics about the drug so you know exactly how it works and what it does to your body. So acetylcholine is a neurotransmitter that contracts your respiratory muscles in your lungs, which can cause an asthma attack. So this medication is an inhibitor of acetylcholine. So it's a chemical that contracts the muscle, like I said, and it basically opens up your lungs and respiratory. So make sure that you can breathe normal, and this medication will open up everything so that you won't have as many asthma attacks or, shortness of breath.
So do you mind doing a return demonstration? That way that I know you know how to take the medication and mom can even watch too.
Yeah. So I have to open the thing, put the pill in, crush it, inhale it, and try to hold it for like 10 seconds and then exhale. And then I don't throw those away, but then I clean out the inside to make sure all the remnants are gone.
Perfect.
So do you have any questions about your new prescription, Spiriva?
I have a few questions.
Okay, yeah.
Are there any side effects or symptoms that I should look out for or that she should be aware of?
Yeah, so I'm going to go over some of the side effects and adverse reactions with you right now. So the most common side effect is dry mouth, and it happens in about 16% of patients, and as well as voice hoarseness. So if you feel like you're having a hard time talking, you're losing your voice, that's a common symptom as well. Spiriva is not absorbed throughout the whole body, so other side effects are uncommon, but you should still know that glaucoma, which is having trouble seeing when you have like these little, it's like a color coating over your eyes, that's a side effect. Increased heart rate, so if you want to count your pulse before you take the medication, Usually the pulse rate is between 60 and 100 beats per minute. So you just put your 2 fingers right underneath the thumb, and you feel the pulsation. And if you have a watch, you're going to count for a whole minute. Okay? And if it's between 60 and 100 beats per minute, that's normal. If it's above that, then I would consider calling your healthcare provider, because maybe they could prescribe you a new medication. So next, constipation and urinary retention are possible side effects as well. So if you're having bad experiences going to the bathroom, you haven't had a bowel movement, or if you're urinating a tiny bit but not a lot's coming out, I would call your healthcare provider as well. A life-threatening side effect with anticholinergic medications, which would be Spiriva, include angioedema, which is when your lips swell up. So, which is severe, and facial swelling. So if your face is getting really red and you feel like it's like bigger than usual, that can be threatening to your life. So 100% you should be calling 911 for emergency treatment. If you notice swelling around your eyes or lips, you should seek medical attention immediately, your eyes as well. To prevent dry mouth, make sure that you're drinking plenty of fluids and suck on candy. So one other thing I want to add is I don't want you to get confused Spiriva with Inspira, which is another medication, because a lot of medications have similar names, and sometimes when you take the wrong medication, that can end up in an allergic reaction, a medical emergency. So whenever you pick up your prescription, make sure that it's 100% the right medication that you were prescribed.
Okay. Does this should I not take, does it affect when I eat, or does it, should I not eat certain things with it, or take other medications with it?
Okay, so do you have a specific time that you eat every day? Do you only have 2 meals a day?
Yeah, I usually don't eat breakfast. Usually I only eat twice a day.
Okay, alright, well that's fine. You can take the medication whenever you'd like. It doesn't interfere with your meals, but I would suggest not drinking a lot of milk, because that could cause some adverse reactions with the medication. Do you drink a lot of milk?
Not really.
Okay, so just make sure that you're limiting your milk intake. Another thing I wanted to tell you about this medication is that it interferes with the medication called ipratropium.
Okay.
Yeah,
I'm not taking that.
Okay, yeah, as long as you're not taking it, and make sure if you are getting anything over the counter at CVS for anything, then just make sure when you read the ingredients it doesn't have ipratropium in it. And when I suggest also that you do eat breakfast, it could be a cultural thing, which I completely understand. Do you ever feel dizzy or weak when you don't eat breakfast?
No, it's most of the time I just don't feel hungry in the morning. Yeah, it's not a cultural thing for me.
Oh, okay. Alright, well if it's not a cultural thing, then I would 100% suggest that you be eating breakfast, even if it's just a little bar of something they have those Luna bars, they have granola bars, things like that, or an egg, something like that to just boost up your protein, especially because when you're taking medications, they get absorbed better when you have food in your body. So if you do take the medication in the morning and you're on an empty stomach, it could cause some GI distress.
Okay.
So I just have one last question. What happens if she happens to miss a dose?
So if you miss a dose, you're going to take it as soon as you remember that you missed it. Just make sure that you're not doubling up on doses, because that can cause some adverse reactions that we don't want to occur. Okay? Okay. So one other thing I want to tell you about this medication is after you're done taking it, I suggest that you rinse your mouth out with water, because it can leave a bad taste in your mouth and throat. So I suggest doing that, especially drinking a lot of fluids, like we mentioned before, to hydrate your body with the side effects of dry mouth. So make sure that you're always rinsing your mouth out with this medication. Okay, so we're done with the treatment today. Do you have any other further questions that I can help you with at this time?
No, I think I'm okay.
Okay, so if you guys ever need anything, just make sure to call the doctor's office, and in a medical emergency, remember to always call 911. Okay?
Thank you so much.
Thank
for your
you.
help.
No problem.